In 2020, the world underwent an extreme health crisis due to coronavirus, also known as COVID-19. On January 31, 2020, the different public sectors conducted a meeting to discuss the first confirmed case of COVID in the country. After the patient arrives from the country, she consulted the health officers about her current condition. As a result, she is declared asymptomatic with the virus. With this, the Interagency Task Force on Emerging Infectious Diseases and DOH notified the public regarding the deadly virus. COVID-19 was initially started in one of the provinces in China, which is Wuhan. Its symptoms are usually common, such as colds, coughs, fevers, and headache, making it difficult to detect, especially if the infected have had contact with other people. In addition, COVID-19 most likely spread like wildfire because everyone exposed to the virus has a chance to be infected. The World Health Organization's approach to assisting national governments in combating the pandemic. After an investigation of the virus, the WHO releases guidelines around the world, such as a safety protocol and measures to address the matter. Since it spread quickly and is easily transferred, the Philippine government devises a unique strategy to prevent the virus from spreading throughout the country. They gather data to help them plan their future steps. The President announced groundbreaking measures to resolve the health crisis experienced in the country. On March 14, 2020, President Duterte ordered an official lockdown in the Philippines starting March 14 to April 14, 2020. During his talk to the people via media, the President assured the implementation of peace and order while serving the public. Therefore, he entrusted the military forces to take charge of the affairs of the people.
The Duterte administration on COVID-19 action displayed a warlike response in which, instead of enshrining science-based actions and approaches, military powers were uplifted. One of the most controversial COVID-19 responses was in the Philippines. According to HAPL 2021, the government imposed a war against COVID-19, which saw the pandemic as an existential threat to society. Given this, the government imposed long and strict lockdowns and curfews overseen by the police and military. However, the government disregarded the science and health sector, which is essential to the fight against COVID-19. For instance, the immense focus on lockdowns and curfews notably neglected the health workers and the hospitals. According to DOH 2022, more than 29,000 health workers were infected by COVID-19, which left the sector dysfunctional. Also, according to Amnesty International 2021, equipment was dire, such as insufficient PPEs, bed capacity, and other needed equipments. In addition, Filipinos, especially the poor, did not have proper access to the hospitals as the hospitals already has its full capacity. Duterte's notion of disciplining the pasaways through coercive force and isolation while leaving the health sector to decay did not render an effective action. Instead of empowering the science and health sector in fighting the intangible enemy, Duterte unleashed his authoritarian leadership in hopes of controlling the virus by controlling the people. In connection with the discussed topic, the government response also rendered a reactive rather than a proactive action. To elaborate, the government did not have a concrete plan to fight against the COVID-19. Instead, they relied on their limited solutions. According to HAPL 2021, the government seemingly relied on the control of the police and military forces in handling the COVID-19 pandemic. The only entirely obvious yet ineffective solutions was the continuous lockdown and curfews, which was handled by the police and military forces. According to Barbera et al. 2021, the LGU under the national government was tasked by the national IATF to impose social, political, economical solutions, but little on health and scientific actions. These solutions were only the age restriction, travel bans, lockdowns, curfews, and only the mandate on vaccination, but nothing more. The government only reacted to the surge of cases and did not implement a prudent and proactive approach. No concrete plan of actions on what to do to prevent the cases. Indeed, the focus on disciplining and isolating the people through military and police powers rendered an incompetent government.
Furthermore, the shoot-to-kill order, aside from it, attacks mainly on the impoverished, preferably the people who need to satisfy their basic needs, is unjustifiable and oppressive. Olano year 2020 stated that in this emergency, this kind of force should never be imposed as it prevents the Filipinos from earning for living and survival. Due to the strict and bloodbath inhumane matter approach, a lot of people suffered financially and many Filipinos lost their jobs, leaving their pockets with no money. If we think about it, people never put themselves at risk if their basic needs are filled sufficiently, and the fact that these people are the ones who only work for themselves while dealing with the pandemic. However, isn't it the implementation, the unjustifiable shoot-to-kill order, criminalizing the poor just because they violate the said protocol imposed for food? We are focusing on their needs and the fact that these people are hungry, since hypothetically speaking, would these people choose obedience over their stomachs? Moreover, Santos year 2020 stated that 21 residents in San Roque, Quezon City were charged with violating quarantine protocols, illegal assembly, and disobedience, and the reason for that is because they lined up alongside the road for relief goods. We see the presumption of President Rodrigo Duterte for implementing a shoot-to-kill order after his statement that we must not fear this coronavirus thingy, for we had only 2 cases, according to Aguilar's article. Now, many Filipinos suffer physically, mentally, emotionally, and even financially. In our final words, is the militarization approach defeated the purpose of stopping the spread of the coronavirus? Did it really contribute if we look at the situation of the Filipinos when it comes to their needs?
To sum it up, there could have been better solution alongside military approach on the COVID-19 pandemic. The militarized response became escalating threat to human rights. The approach must concentrate hard on science-based actions and have strict concrete plans to control the virus instead of having a quick, superficial, or temporary solution to the problem that does not address or resolve the underlying cause of it. While the government deployed measures to address the impact of COVID-19 to public health, it is the visible presence to the police and military on the streets enforcing the lockdown in which evinced a militarization of the government's response to the COVID-19 pandemic. This containment plan, reminiscent of the military tactic of hamletting, was made more luminous by President Rodrigo Duterte himself. Particularly concerning was the President's shoot them demand declaration, pertaining to how the police should treat recalcitrant violators of the lockdown order. Many Filipinos found this remark appealing because it disregards the fact that a significant portion of different areas' population has to leave their homes to work to ensure their daily survival. Therefore, the war on COVID-19 has serious consequences. Through the archetype of the disobedient, the government has wittingly or unwittingly turned the Filipino people into the enemy. This came to be as the virus, initially conceived as an unseen enemy, creeping to infect, kill, and upend the lives of Filipinos, took a corporeal form. In other words, COVID-19's deadly and devastating qualities were soon embodied with the bull-headed character of the disobedient. It became the enemy order and consequently the object of disciplining and punishment.